Mohammed Munir is a virologist with Lancaster University. He joins us now live from Lancaster in the United Kingdom. Thank you for joining us on the program again. Earlier that you shared that 10 seriously ill patients had improved within 24 hours after receiving plasma from the blood of people who've recovered from the virus. So is this a significant breakthrough in the treatment of this illness?
Yeah, well, I mean, this Wuhan coronavirus is just 1.5 months old, and at this moment, we don't have any vaccine or therapeutics available. So in these situations, the only possible way is really look into the convalescent sera, the sera that can be collected from the patient who have recovered from the infection, and that could be a source of antibodies. These are the molecules, those are raised against the pathogens when they infect the human, and those antibodies within the plasma of the blood could be a source to not only to eliminate the infection but also improve the chance for people who are critically ill. But the major challenge is really that the scale of the outbreak is really high. Thousands of people are already infected. Although the number of the recovered patients is quite good, however, the amount that is required to apply for the critical sick patient is really broad, and therefore I don't really think this is again a viable solution. However, this is something that can be applied to especially elderly people or the people who are having a really critical situation.
Recently, we've started to see the number of new cases of the virus slow down while more people are being released from the hospital after recovering. So is this a positive sign? Is this a sign that the outbreak might be peaking?
Absolutely. I think this is a good news, mainly because Chinese government has been very proactive in applying all those control measures and the quarantine required at a very timely manner. And I think those control measures are really now paying off. And I think the overall impact of this disease over the time will reduce unless the number of cases start to emerge in the developed or thin economies where the infrastructure is lacking. But within China, this is how what we anticipated is going to go into a positive direction.
Mm-hmm. Earlier today, we learned that the director of a Wuhan hospital had died from the coronavirus, and we've seen some 1,700 health professionals become infected. How much of a concern is it that the people who are on the front lines of this outbreak, and in the case of the future outbreaks would also be there as well, seem to be so vulnerable to this illness?
That is absolutely true. Not only in this situation, but in any outbreak, most of the vulnerable people has been the medical staff, because they are at the forefront and they have a highest time of contact with the patient. And especially in this situation in China, because the number of infected patients increase exponentially within a short period of time, the overall burden onto the health professional has been significantly higher than the normal situation. Therefore, this overworking pressure and also having less precautionary measures in place that led to higher vulnerability to the healthcare workers. And I think this is something where the international community help is required to really provide all those not PPE, but also the support that is required to alleviate some of the burden onto the health professionals.
Mm-hmm. Let's talk about this study by the Chinese Center for Disease Control and Prevention. It gives us some more details on the disease, such as most infections, some 80% are considered mild, with less than 5% critical. So what does this study tell us about the coronavirus?
This study really provide conclusive information about the entire scenario of the coronavirus in China. So this study, what it took all the patients right from the beginning of the outbreak until 12th of February, and all those cases were analyzed to see if there is any gender predisposition or there is any liability for any of the patients. So I think this is a conclusive information that really take a lot from the overall scenario. So I think the important message here is really the overall mortality has low compared to SARS and MERS. But one thing that remained really important, not only in the Wuhan coronavirus, but in the whole situation, is that the number of people who have died by this Wuhan coronavirus is significantly higher than the SARS and the MERS within the short duration, which is likely gonna be impacted by the people who will be returning by the extended lunar year or opening of the school. So that is something that we have to be very vigilant about this in the near future.
Okay, we'll leave it there. Mohammed Munir joining us from Lancaster in the United Kingdom. Thank you.